Hello friends, welcome to my new video on respiratory problems in the elderly, COPD, asthma, pneumonia, and breathing tips. Let's jump the video. As we age, our lungs and respiratory system gradually lose strength, making it easier for health problems to appear. For many elderly individuals, conditions such as COPD, asthma, pulmonary fibrosis, and infections like pneumonia can seriously impact daily life. Even mild respiratory issues can reduce energy, make walking or climbing stairs difficult, and increase the risk of hospitalizations. Recognizing early warning signs and taking proactive steps is key to maintaining independence and quality of life. In this video, we'll explore the most common respiratory problems in the elderly, discuss how to recognize pneumonia, understand the consequences of untreated lung infections, and provide practical tips like breathing exercises, energy-saving techniques, and monitoring shortness of breath. By the end, you'll feel more confident in supporting yourself or your loved ones in maintaining healthy lungs, responding to emergencies, and preventing complications. Common respiratory problems in the elderly. Several respiratory problems are common among older adults. Chronic obstructive pulmonary disease, or COPD, is characterized by persistent airflow limitation, often due to long-term smoking or environmental exposures. People with COPD may experience shortness of breath, chronic cough, and wheezing. Pulmonary fibrosis is another serious condition where lung tissue becomes scarred, making it harder to breathe deeply. The scarring reduces oxygen transfer and leads to fatigue, chronic breathlessness, and sometimes a persistent dry cough. Asthma is not just a condition for children. Older adults may develop late-onset asthma, with symptoms including wheezing, chest tightness, and difficulty sleeping due to shortness of breath. While each condition has unique causes and treatments, they all share one major risk: increased vulnerability to infections like pneumonia, which can quickly become life-threatening if not recognized and treated promptly. Pneumonia in the elderly: recognition and consequences. Pneumonia occurs when the lungs become inflamed, usually due to bacterial or viral infection. In elderly individuals, pneumonia can develop rapidly and often presents differently than in younger adults. Common symptoms include fever, chills, persistent cough, shortness of breath, fatigue, and confusion. Because the immune system weakens with age, older adults may not show typical signs such as high fever. Confusion or sudden weakness can sometimes be the first indicator that pneumonia is present. If pneumonia is recognized early, prompt medical treatment with antibiotics or antiviral medication, oxygen therapy, and rest can prevent severe complications. Early detection is critical to avoiding hospitalization, sepsis, or respiratory failure. Breathing exercises and energy-saving techniques. Breathing exercises strengthen lung function and make daily activities easier. Pursed lip breathing involves inhaling slowly through the nose and exhaling through pursed lips, helping control airflow and reduce shortness of breath. Diaphragmatic breathing focuses on using the diaphragm rather than shallow chest breathing, improving oxygen intake. Energy-saving techniques reduce fatigue for elderly individuals with respiratory conditions. 1. Break tasks into smaller steps. 2. Sit while performing chores when possible. 3. Avoid lifting heavy items or climbing stairs unnecessarily. 4. Rest frequently between activities. Regular practice of these exercises can improve endurance, reduce anxiety related to breathing difficulties, and help the elderly maintain independence. Daily respiratory health and prevention. Maintaining lung health in older age involves a combination of lifestyle habits and medical care. Encourage regular exercise, which strengthens respiratory muscles. Avoid smoking or exposure to pollutants. Stay up to date on vaccinations, including the flu and pneumonia vaccines. Nutrition also matters. A balanced diet supports immune function. Hydration helps keep mucus thin, making it easier to clear from the lungs. Regular checkups with healthcare providers help detect early signs of respiratory decline. Conclusion and encouragement. Respiratory problems in the elderly, such as COPD, asthma, pulmonary fibrosis, and pneumonia, can be challenging but manageable. Awareness of symptoms, early intervention, and consistent care are key to maintaining quality of life. Always watch for subtle signs of pneumonia or shortness of breath. Use breathing exercises and implement energy-saving strategies to make daily life easier. Support from caregivers and family, along with regular medical guidance, ensures the best outcomes. Remember, lungs may weaken with age, but knowledge, preparedness, and proactive care empower older adults to breathe easier, stay independent, and live healthier lives. Please subscribe our Guardian Home Care YouTube channel to get more videos. See you soon with the next video. Bye.